This iTransfuse podcast is based on fact sheets you can find at transfusion.com.au, the Australian Red Cross Blood Service website for health professionals. So firstly, what are immunoglobulins?
Immunoglobulin is another name for antibody. Antibodies are molecules made by a specialised immune cell called the plasma cell.
What do immunoglobulins do?
Their role in our body is to fight infection and disease.
Okay, so where is immunoglobulin found in the body?
Immunoglobulin is mainly found in plasma, but there are a few types that can be found elsewhere, such as in saliva and other fluids.
Why is immunoglobulin important?
Immunoglobulin that is extracted from plasma can be used to treat a number of medical conditions.
How is immunoglobulin given to patients?
Immunoglobulin treatment can be given to a patient in 3 different ways. Intravenously, which is the most common way, meaning it is given through a vein. It can also be given subcutaneously into the tissue underneath the skin, or intramuscularly as an injection into the muscle.
I hear the term IVIg regularly. What is this?
IVIg is an immunoglobulin that is intravenously administered. IV means intravenous. Ig is short for immunoglobulin.
Is IVIg expensive?
IVIg is a very precious resource because we rely on blood donors to supply the plasma. Each individual treatment costs many thousands of dollars, depending on the condition and frequency of treatment required.
So what patient conditions require immunoglobulin therapy?
There are 2 major types of conditions that require immunoglobulin infusions: replacement therapy and immunomodulating therapy. Replacement therapy is for patients who do not make enough immunoglobulin of their own, and as a result, they have an immune deficiency. Immune deficiencies can either be primary, so they are inherited from birth, or secondary, so those are acquired from other diseases or treatments, for example cancer. Immunomodulating therapy is used to prevent further attacks of autoimmune disorders. Autoimmune disorders are those where the body's immune system attacks the body's own tissue by mistake.
How much plasma is required to make IVIg?
Large amounts of plasma are required to make IVIg. It takes plasma from 8 whole blood donors to make one 200 ml vial of Intragram P IVIg.
You mentioned Intragram P as a brand of IVIg. Are there other brands available?
The National Blood Authority tenders for IVIg, and currently Intragram P, IVIg and Octagam are available in Australia.
The fact sheets and podcasts are designed to provide basic information to people without training in health or science. They are not intended to be medical or professional advice. The disclaimer on transfusion.com.au applies to this podcast. For more information or to view the fact sheets, log on to transfusion.com.au. To become a blood donor, log on to donateblood.com.au.